Hello, you're watching DD News and I'm Preeti presenting Tracking COVID-19, a special show that will bring to you all the updates on the pandemic that has not just left the world behind the eight ball, but has also sent shivers with its enormity. In this special newscast, we bring to you the measures taken by the centre and the respective state governments to ensure that elaborate precautions announced by the centre are adhered to so that the chain of transmission is interrupted. Along with the messages of social distancing and isolation, the crux practice which has to be followed here is to wash your hands regularly, and if soap and water is not easily available where you are at present, use a hand sanitizer just the way I will do in front of you. And here, this is the best way to keep yourself safe. Remember, not just clean the palm of your hands and the backside of your hands, but also the web of your hands to ensure that you remain healthy and you remain clean and hygienic. Remember, by doing this, you will be the biggest corona warrior. And also we've seen the measures, the efforts which are being put in our hospitals by the doctors, but staying safe at home will also help you in doing your bit against coronavirus. First, we get you the top stories, all the updates related to coronavirus in this fast news. Prime Minister Narendra Modi to share his thoughts in his Mann Ki Baat program at 11 a.m. today. Prime Minister tweets, this edition to focus on COVID-19 situation. Program to be broadcast on the entire network of All India Radio and Doordarshan. "275 people evacuated from coronavirus hit Iran arrived at Jodhpur in Rajasthan. All evacuees moved to Army Wellness Facility after preliminary screening." Nation responds to Prime Minister's call for contributing to PM CARES Fund. Legislators, film and sports personalities pledged support to the fund for fighting COVID-19. Prime Minister says the fund will help tide over distressed situations and create a healthier India. The main thrust of the Ministry of Health to deal with coronavirus is on the creation of specialized hospitals for COVID-19. The ministry says it is working with states for community monitoring and rigorous contact tracing. Total number of confirmed cases in India crosses the 900 mark. Important announcement for migrant workers. Home Ministry says state government can provide shelter and food to those in need with support from State Disaster Response Fund. Centre directs states to ensure food and shelter for migrant labourers returning home. Finance Minister Nirmala Sitharaman interacts with CMDs of public sector banks. Finance Minister asks them to ensure uninterrupted banking services across the country while maintaining social distancing norms. And COVID-19 death toll in Italy goes past 10,000. Spain announces stricter measures. US President Donald Trump hints at New York quarantine as US death toll is over 2,000. South Korea reports more recoveries than active cases. Prime Minister Narendra Modi will be interacting with people of the nation through his Mann Ki Baat program. This will be the first edition after the lockdown and it will be aired on public broadcasters at 11 a.m. today. Late last night, Prime Minister took to Twitter to inform that this edition will be focused on the situation prevailing due to COVID-19. A batch of 275 people evacuated from coronavirus hit Iran arrived at the Jodhpur airport in Rajasthan today. The batch includes 133 women, 6 children and 142 men. Now, as per the procedure, preliminary screening of the evacuees were conducted at airport upon arrival by the medical teams from the civil administration and the army. Thereafter, they were moved to the Army Wellness Facility at Jodhpur. The Army authorities, as part of Operation Namaste, have created Army wellness facilities which comprise of all amenities and are fully geared up to accommodate all the evacuees and provide them with requisite medical and administrative support during their quarantine period. Now, these people will be kept for 14 days at the special quarantine centers set up by the Army in Jodhpur. During this period, a team of qualified doctors and nurses will take care of them. The first batch of 277 evacuees at Jodhpur have since then settled down comfortably and are being regularly monitored by the Army medical teams. And it is often said that every dark cloud has a silver lining. While the entire nation braves the outbreak of the pandemic, there are also times and instances that show that hope still lives on in this hour of crisis. In our next segment, that is Positive News, we bring to you instances which show how the nation stands united amidst these difficult times. With the aim to provide further impetus to meet the challenge of COVID-19 outbreak, Prime Minister Narendra Modi has set up Prime Minister Cares Fund in which citizens can make donations. Prime Minister shared this information on Twitter. He tweeted, and I quote him, "People from all walks of life express their desire to donate to India's war against COVID-19. Respecting that spirit, the Prime Minister's Citizen Assistance and Relief in Emergency Situations Fund has been constituted." Now, this will go a long way in creating a healthier India. He appealed to all Indians to contribute to the Prime Minister Cares Fund. This fund will also cater to the similar distressing situations if they occur in the times ahead. The PM Cares Fund accepts micro donations as well. It will strengthen disaster management capacities and also encourage research on protecting citizens. Let us leave no stone unturned to make India healthier and more prosperous for our future generations. Now, on your screens are the details of how you can contribute to this fund. And following Prime Minister's appeal to the citizens of the nation to contribute to PM Cares Fund, people from all walks of life have come forward to contribute to the fund and show their solidarity in the fight against COVID-19. Lok Sabha Speaker Om Birla has appealed to the MPs across party lines to contribute ₹1 crore from their MP-led funds to the Prime Minister's Citizen Assistance and Relief in Emergency Situations Fund, or the PM Cares Fund. The donations will be used to ensure the availability of screening kits, masks, personal protection kits and other medical equipments needed to fight COVID-19 pandemic. He emphasized that the people's representatives should ensure that the lockdown does not impede the poor and the needy in meeting their basic needs. Rajya Sabha Chairman also wrote to RS MPs appealing them to release ₹1 crore from their MP-led funds for fighting COVID-19. And in our next segment, we get to the update, the Corona update. India has 867 Corona active cases, with 79 cases cured and discharged and 25 deaths so far. Maharashtra is the worst hit state with 183 active cases, excluding foreign nationals, and Kerala has taken the second worst Corona hit state with 174 Indian cases. Up next, we're joining from our correspondent Nitendra to get us more details. Nitendra, 867 active cases have been reported from India when we talk of COVID-19. You let us know the latest.
जी बिल्कुल, एक्टिव केस 867 हो गए हैं और टोटल अगर बात की जाए केस की, पॉजिटिव केस की, तो 979 केसेस हो गए हैं। और अच्छी बात यह है कि इसमें 86 लोग को इलाज के बाद छुट्टी दे दी गई अस्पताल से। तो ये एक बहुत अहम बात है कि अगर आप डॉक्टर के प्रोटोकॉल का पालन करते हैं और उनके निर्देश के हिसाब से आप ट्रीटमेंट लेते हैं तो आप पूरी तरीके से ठीक हो सकते हैं। और इसीलिए 86 लोगों को अस्पताल से छुट्टी दे दी गई। और डेथ की हम बात करें तो टोटल 25 लोगों की डेथ हो चुकी है अब तक। और ये वो लोग हैं जिनकी उम्र 60 साल से ऊपर है, 60, 65, 70 इस तरह की इनकी एज ग्रुप है। और उनको और भी दूसरी बीमारियां थी, जैसे हाइपरटेंशन, डायबिटीज या किडनी के पेशेंट थे। ऑलरेडी उनको बहुत सारी बीमारियां थी, जिसकी वजह से जब कोरोना वायरस से संक्रमित हुए तो उनकी और भी हालत खराब हो गई और उसके बाद उनकी डेथ हो गई। तो ये एक पूरी तरीके से दृश्य है देश का। लेकिन अच्छी बात ये भी है कि जितने भी लोग संक्रमित देश से आए हैं और उनका जो इनक्यूबेशन पीरियड है 14 दिन का, वो करीब करीब पूरा हो रहा है। तो इस वजह से ये केसेस देखने को में मिल रहे हैं और उनकी ट्रेसिंग हो रही है। और अगर जो 21 दिन का लॉकडाउन का सरकार ने जो डिसीजन लिया है, अगर इसका पालन लोग करें, घरों के अंदर रहें, तो निश्चित तौर पे इसके संक्रमण के मामले को कम लाने में मदद मिलेगी। बार बार सरकार की तरफ से अपील की जा रही है कि आप लोग घरों के अंदर रहें, और जितना आप घर के अंदर रहेंगे उतने संक्रमण को फैलने से रोका जा सकता है।
Yes, keep yourself isolated in your homes, and this is the biggest precaution you can take against COVID-19. Thank you so much, Nitendra, for joining us with those details. And in Gautam Budh Nagar district, salaries under certain circumstances must be paid to the labourers or employees during the coronavirus lockdown. Gautam Budh Nagar district magistrate B.N. Singh said on the failure to do so, the law will take its own course under the National Disaster Management Act 2005. He also said that COVID-19 positive persons or possibly infected persons who are in isolation will be given a 28-day paid leave after they procure medical certificates. Mr. Singh added that those employed at shops, factories and other units closed due to lockdown will also be paid. And with the number of COVID-19 positive cases in Tamil Nadu crossing 40, the state government has announced containment measures to halt the spread of the disease. Officials said that a 5 kilometers radius zone of the containment is being demarcated around the houses of those who have tested positive for the virus, and a 3-kilometer radius buffer zone in 10 districts. The state health workers will visit every house in the containment zone and check for people with symptoms of COVID-19. They will also be creating a list of people with other ailments like heart and kidney issues. The aim of implementing containment zones and buffer zones is to stop the spread and flatten the curve. The state is now at the second stage of the pandemic cycle, with the authorities seeking to prevent community transmission, which would mark the onset of the third stage. In Arunachal Pradesh, the total samples of 19 persons was sent for testing yesterday, out of which 12 have tested negative, while 7 were positive. In view of the lockdown, the district administration of the capital, Itanagar, has fixed the timing for opening of shops from 9 a.m. to 3 p.m. The union government as well as the state governments are taking several steps to help migrant labourers and stem their exodus. Minister of Home Affairs has directed states and union territories to use SDRF fund allocations to make provisions for temporary accommodation, food, clothing, medical care, etc. for homeless people, including the migrant labourers stranded due to the lockdown. Cabinet Secretary Rajiv Gauba spoke to chief secretaries of all states to ensure food and shelter for migrant labourers returning home.
States can explore the option of setting up tented accommodation for those who are on the road और जिनको अभी वापस लाने में समय लगेगा. दूसरा, जहाँ भी रिलीफ कैंप्स हैं वहाँ पे मेडिकल चेकअप ड्राइव्स करवाएं, जिससे कि हमें पता चल सके कि हाउ इज़ द हेल्थ स्टेटस, और उस पर फिर अकॉर्डिंगली स्टेट्स और यूटीज एक्शन ले सकती हैं.
And from here we go across to Chandigarh to know the COVID-19 situation in the Union Territory. And for that, Akansha is joining us. Let us see this report. Or before we get that report to you, we'll get that report. All right, I think there was some problem in getting through the connection with Akansha there in Chandigarh. We'll try getting back to her again. At this point in time, our correspondent Sudhakar is joining us to get us more. Sudhakar, we have apprised our viewers about the condition of the migrant workers who are returning to their hometowns. Let us know more updates and the latest on the issue.
देखिए लगातार क्योंकि एक तरह से इवॉल्विंग सिचुएशन है और
आपको मेरा आवाज नहीं आ रहा,
से पूरी दुनिया जूझ रही है. ऐसे में खास तौर से अगर केंद्र सरकार की बात करें तो जिस तरह से स्थितियां सामने आ रही हैं उसके लिहाज से कदम उठाए जा रहे हैं. और एक समस्या माइग्रेंट लेबर्स की दिखी थी, सिर्फ दिल्ली नहीं कई राज्यों में बड़े शहरों से पलायन दिखा था. उसको देखते हुए लगातार ये कोशिश की जा रही है कि लोगों को समझाया जाए उनके स्वास्थ्य के हित में, देश के हित में, सोसाइटी के हित में ये है कि जो जहां है इस वक्त वहीं रुके। लेकिन इसके लिए जो जरूरी प्रोविजंस हैं वो भी किए गए हैं। हमने कल ही देखा कि गृह मंत्री ने समीक्षा बैठक बुलाई थी। इसके अलावा कैबिनेट सेक्रेटरी और होम सेक्रेटरी ने भी राज्यों के चीफ सेक्रेटरी, डीजीपी से बातचीत की थी, और जो जरूरी इंतजाम हो सकते हैं, मतलब उनके रहने की व्यवस्था, खाने की व्यवस्था, उनके लिए और भी जो जरूरी इंतजाम हो सकते हैं वो किए जाए। और इसके लिए संसाधन की कमी ना हो तो SDRF जो स्टेट डिजास्टर रिस्पॉन्स फंड है उसके मार्फत खर्च किया जा सकता है। तो SDRF में अभी भी राज्यों के पास पैसा बचा हुआ, अगले साल के लिए केंद्र सरकार ने 29,000 करोड़ रुपए का प्रोविजन, 29,000 करोड़ रुपए का प्रोविजन किया हुआ है। तो पर्याप्त पैसा है राज्यों के पास की इस व्यवस्था में, चाहे रिलीफ कैंप स्थापित करना हो, खाने की व्यवस्था करनी है, उनके कपड़े की व्यवस्था करनी है या अन्य व्यवस्थाएं करनी हो, तो वो तमाम व्यवस्थाएं कर सकता है। इसके साथ एक कह सकते हैं संवेदनशील तरीके से उस पूरे मसले के हल की कोशिश की जा रही है। एक तरफ तो लोगों को जागरूक किया जा रहा है, दूसरी तरफ अगर बहुत मुश्किल हालात में है तो उनको घर तक पहुंचाने की व्यवस्था हो जाए, उस तरह की चीजें भी की जा रही है। तो कई स्तर पर इस समस्या से निपटने की इस कोशिश की जा रही है। लेकिन अब सबसे जरूरी चीज है सोशल डिस्टेंसिंग, उसके लिए लोग जहां पे हैं वहीं पर रुके, उसकी व्यवस्था अहम तरीके से हो सके, जल्दी हो सके, इसके लिए कोशिशें और केंद्र राज्य मिलकर इसके लिए लगातार प्रयास कर रहे हैं।
All right, Sudhakar, thank you for joining us and giving us the details of the measures which have been put in by the centre and the state government when we talk of the efforts aimed at improving the situation of the migrant labourers. At this point in time, we'll go across to our correspondent Akansha, who's joining us from Chandigarh. Akansha, we have told our viewers about how people are practicing social distancing and isolation. You tell us there, how is the day going on there in Chandigarh?
See, it's the day 5 of the curfew here in Chandigarh, and you can see that people are maintaining the distance. And there are shops, there are Kriana shops, there is a chemist there, and you can see that people are, there has been marking done by the government, and people are standing, maintaining a distance, and nobody is allowed inside the shops. The shopkeeper takes the note and then delivers the things outside so that there is no rush inside. And the relaxation was given yesterday only from 10 a.m. to 6 p.m. It was given for such a long time because there should be no rush in the shops. So you can see that this is the whole area is manned by, they are police personnel also here to take care that there is no rush. And see, people are standing. And people are standing, and everybody is getting everything. Vegetables are going door to door, and there is milk also, there is bread. The essential commodities have been provided to everybody. The chemists are there, the sanitation is see, you can see at the back, the sanitation workers are working. So everything is at place. The only thing which has to be done is that you have to stay safe and you have to stay home and you have to abide by the government's directives and you should not come out. In Chandigarh also, with this relaxation, you are only allowed to come on foot. You cannot come by vehicle. If you are coming by vehicle, then strict actions are taken. You can see at the back that all the essential commodities have been coming. They have been delivered and people are getting it. And people are getting.
All right, so the essential commodities are available in adequate stock there in Chandigarh, and also people are practicing isolation and social distancing. Thank you so much, Akansha, for joining us with those inputs from Chandigarh. And Finance Minister Nirmala Sitharaman today appreciated the dedication and efforts being made by Canara Bank to comply with social distancing, hand sanitization and other measures while providing mobile ATM services at the customer's doorstep in various localities of Chandigarh. Yesterday, in a detailed conversation with chiefs of both the public and private banks, the Finance Minister stressed that it is encouraging to know that they are doing their best even during the lockdown. They are certain that they'll ensure customer service without disruption. Social distancing is being adhered to this as well. Finance Minister also asked the CMDs to make sure that there was adequate liquidity at the branch, ATM and banking correspondent level. The finance minister acknowledged the role of public sector banks and encouraged them to keep up their efforts in providing uninterrupted banking services across the country. And during the call, the finance minister instructed the CMDs to ensure all branches and ATMs remain open and continue their operations, implement social distancing at all points, provide authorization to bank staff, and also coordinate with district administration for smooth passage of the bank staff. And the Johns Hopkins University has now disassociated itself from a study which had earlier predicted a higher number of casualties in India due to COVID 2019 India. The varsity has also said that the use of its logo on the report was not authorized. All right, as again we reiterate the fact that you have to be responsible for your good health and the good health of your near and dear ones. Follow isolation, follow social distancing, but also make sure to follow personal hygiene, to maintain personal hygiene. Wash your hands repeatedly after 20 minutes, or for that matter also use a sanitizer. These are the reminders which we have been continuously giving as the public broadcasters to ensure that the nation stays safe. And with that,